Welcome and thank you for standing by. Today's call is being recorded. If you have any objections, you may disconnect at this time. All participants are in a listen-only mode until the question-and-answer session of today's conference. At that time, you may press star 1 on your phone to ask a question. I would now like to turn the call over to your host, Amy Romero. You may begin.
Thank you. Good afternoon, everyone, or good morning, depending on where you are. Welcome to the 2020 TOR Orientation Webinar. My name is Amy Romero. I am a project officer with the TOR program, and congratulations on your new grant award. We are very excited to have you as part of the TOR program. We will start with some housekeeping announcements. All lines have been muted. We will take questions after each presentation today. The operator will give us guidance on how to unmute your line after each presentation. And you can also ask questions via chat at any time. Please enter your name, the name of your grant, and the ID of your grant on the chat box to let us know that you are here today. So if you could do that now, that will be helpful. And also at the end, I will provide another reminder just to make sure that we know who is in attendance today. We will send the PowerPoint to everyone after this webinar. At this time, I will turn it over to Dr. Alex Thundercloud, the Director of the Office of Tribal Affairs and Policy.
Thank you, Amy. Good afternoon, everybody, and I am very happy to welcome you as our third cohort to the Tribal Opioid Response Grant Program. You guys are joining a wonderful team of grantees. Some of you may be new, and others may have already been prior recipients of our TOR funds from SAMHSA. We do have an excellent team that you will become very familiar with through the implementation of your grant program. I would just like to share a few words on how SAMHSA supports tribes. We're very committed to the supporting the delivery of services and resources that maintain and improve behavioral health of American Indians and Alaska Natives. And the SAMHSA Office of Tribal Affairs serves as the primary point of contact for tribes, tribal organizations, urban Indian health programs, and other stakeholders on behavioral health issues pertaining to American Indians and Alaska Natives. We also lead and support SAMHSA-wide actions to improve behavioral health of tribal communities, as well as leading SAMHSA's tribal consultation, outreach, education, engagement efforts, and our work with our Tribal Technology Advisory Committee, comprised of elected tribal leaders from the 12 IHS areas. Next slide, please.
Thank you, Dr. Thundercloud.
Yep.
So here is our agenda for today. We will provide a TOR program overview and discuss the programmatic expectations. We have with us today Olivia Klein-Thomas, the Grants Management Specialist for this cohort, and she will provide guidance on the financial requirements and processes for the grant. We also have on the webinar today Humberto Carvalho from the ATTC, and he will provide an overview of the technical assistance resources available for the TOR grantees. And at the very end, we will also have some time for questions. Okay, we will start with the Tribal Opioid Response TOR program overview, and I will be doing this presentation with my colleague, William Longinetti, today. So here you can see the regions. These are the HHS regions, and we have 3 GPOs. I work with HHS regions 1, 2, 4, and 10. Lenny Simon is assigned HHS regions 5 and 6, and William Longinetti is assigned HHS regions 7, 8, and 9. You can see the states on this slide. If you don't know who your GPO is, here you have the name of your GPO. We will share our contact information at the end of the presentation, And we are working with each program to schedule individual calls to discuss your grant application and to help you with the startup process. Please contact us if you have any questions. TOR program purpose. The main goal of the TOR program is to address the opioid crisis in tribal communities by increasing access to culturally appropriate and evidence-based practices. The 2020 FOA allows programs to also address stimulant misuse and use disorders. That includes cocaine and methamphetamine. The intent is to reduce unmet treatment needs and opioid overdose-related deaths through the provision of prevention, treatment, and recovery support services. This is a map with the locations of all the TOR grantees. The TOR program has 3 cohorts. In 2018, SAMHSA funded 134 TOR grantees. In 2019, 30 new grantees were funded. And in 2020, we funded 92 grantees. So here you can see the locations. TOR expectations. These are listed on the funding opportunity announcement. The TOR program funds the entire behavioral health continuum of care. Depending on the needs of your tribe, you can provide education and prevention. You can provide early intervention, treatment, or recovery support services. You can fund only prevention efforts or only recovery support services or a combination of services. There is a lot of flexibility with the TOR program. SAMHSA gives you 4 months to start up your program, but you should start seeing clients and providing services by no later than January 30th, 2021. Key personnel. The only key personnel for the TOR grant is the project director. If possible, we recommend that the project director is someone that works directly with the TOR grant because they are our primary contact. They are the ones that will receive the information that is sent by SAMHSA. ERA also sends information to the business official listed on the grant. TOR required activities. The required activities can be found on page 7 of the FY 2020 TOR funding opportunity announcement. You do not have to implement all of the required activities listed on the FOA. You can select the activities that are appropriate for your tribe. The first one is the development of a strategic plan. You can submit the tribal action plan as your strategic plan. We also provide technical assistance with the AIAN ATTC for this task. They have developed a template if you need one. Contact your GPO if you need assistance with the development of your strategic plan. You can also implement workforce development activities, for example, SUD and MAP training, naloxone training, or peer recovery support certifications. As part of prevention, you can develop strategies which include elder education, outreach and engagement of youth, strategic messaging, and community prevention activities. You can develop strategies to purchase and disseminate naloxone. As part of treatment, you can implement hub-and-spoke models, MAT programs, psychosocial services such as counseling, psychoeducation, cognitive behavioral therapies, motivational enhancement therapy, toxicology screening, individual, group, or family therapy, and case management. You can also implement the specialty programs such as emergency departments and urgent care, also inpatient and residential programs. Recovery support services. These include recovery coaches, spiritual support, drug-free social engagement, and recovery housing. Grantees must ensure that recovery housing is in an appropriate and legitimate facility, If you do not have recovery housing in your community, please contact your GPO. We will work with you to ensure that you fund housing for clients in need. Also, you can provide a treatment transition for clients reentering communities from criminal justice settings. Many grantees are working directly with jails to provide reentry resources prior to release. And last but not least, you can assess the impact of the grant. Consider working with the tribal epicenters or an evaluator to help you with GIPRA requirements. TOR Allowable Activities. The TOR program allows you to incorporate culturally appropriate and traditional practices into your program design. Many grantees have incorporated talking circles, sweat lodges, the Red Road to Wellbriety, tribal healing ceremonies, drumming, traditional healers, spiritual and cultural recovery type of sessions, and gonas. So you are able to incorporate any traditional practices into your design. You can support innovative telehealth strategies, especially now during this time of COVID, and address barriers to receiving MAT or other treatment services by reducing the cost of treatment. And you can also use TOR funding to cover the cost of copays. Okay, I will now turn it over to William Longinetti.
Great, thank you, Amy. Can you hear me okay?
Yes.
Okay, thank you. Hello, everyone. My name is William Longinetti. Along with Amy, I'm another public health advisor at SAMHSA, and I serve as a government project officer on the TOR grant. I know I've worked with many of you before on your TOR grants, and I'm excited to be continuing to work with you on your new TOR award. So I'm going to be talking about some of the other expectations on the TOR grant. Amy, if you could go to the next slide. Oh, let's see, I now have the host privileges, so I can do it. So here are some of the other expectations. SAMHSA expects that recipients currently receiving opioid-related funding from other federal programs must coordinate activities with these other programs to eliminate duplication of services and programs. Also, recipients must utilize third-party and other revenue realized from the provision of services to the extent possible. SAMHSA strongly encourages all grant recipients to adopt a tobacco-free facility and to promote abstinence from all tobacco products, except in regards to accepted tribal traditions and practices. Recipients are also expected to facilitate health insurance application and enrollment process for eligible uninsured clients. Recipients should also consider other systems from which a potential service recipient may be eligible for services, for example, Veterans Health Administration. Using evidence-based practices. SAMHSA's grants are intended to fund services or practices that have a demonstrated evidence base and that are appropriate for the population of focus. An evidence-based practice refers to approaches to prevention, treatment, or recovery that are validated by some form of documented research evidence. With your TOR grant, all grantees are required to use evidence-based medication-assisted treatment with patients diagnosed with opioid use disorder. Grantees will also be expected to utilize other evidence-based practices in conjunction with required EBT, which is medication-assisted treatment. Grantees are encouraged to visit the National Institute on Drug Abuse website for more information on EBPs. We've included the link there. And also, we've included a link to a useful SAMHSA publication called Modifying Evidence-Based Practices to Increase Cultural Competence, an overview. And this is something, if you have any questions, please don't hesitate to discuss this with your project officer. Funding limitations and restrictions. So there are a number of funding restrictions on your TOR grant that you should be aware of. One is that Up to a combined total of 25% of your total grant award may be used for data collection, performance assessment, and infrastructure development. So when you add up the amount of funding you're allocating towards data collection and infrastructure development, it cannot exceed 25% of your total grant award. Another restriction is that only FDA-approved products can be purchased with TOR grant funds. Third restriction is that funds may not be expended through the grant or a subaward by any agency who would deny any eligible client, patient, or individual access to the program because of the use of FDA-approved medications for the treatment of substance use disorders. So as a TOR grantee, you cannot deny someone access to your grant program because of their use of Suboxone or methadone or other FDA-approved medications for the treatment of substance use disorders. The last restriction we mentioned is that grant funds may not be used directly or indirectly to purchase, prescribe, or provide marijuana or treatment using marijuana. Grantees must submit an attestation letter signed by your authorized representative or business official via ERA Commons. Now we're going to talk about some of the progress reporting and data collection on the grant. So we have the program performance reports. Grantees are required to submit a progress update at the midpoint of each grant year. So you're required to submit a mid-year progress report. The first report should cover the first 6 months of your grant, and this is due April 30th, 2021. So that's 30 days after the end of the first 6-month reporting period. The annual PPR is required on an annual basis, and it must be submitted no later than 90 days after the end of the budget year, which is by December 30th, 2021, in ERA Commons. The due date is stated in the Notice of Award. So if you look at your Notice of Award that you received at the beginning of this grant, it will have more information about these required reports. GPO responsibilities. So this is basically the role of Amy and Leanie and myself as your GPO. So we will assist grantees by monitoring the overall grant performance, including how funds are allocated, by serving as your main point of contact to discuss program issues, by supporting you to achieve successful outcomes, and by providing information on your grant performance to SAMHSA management, other government agencies, and to Congress. And here are some important grant documents for you to be aware of. The first is the funding opportunity announcement. The POA contains all of the requirements and restrictions of the TOR program. This was the document that you responded to with your grant application, and so it's definitely something you should continue to consult if you have questions or you're unsure about what's required in the TOR grant. The second important document is the grant application that you submitted. You will be expected to implement your activities and spend your funding according to the application and budget that you submitted. If you plan to deviate from your application, this is something you should discuss with your project officer prior to implementing any changes. And the third important grant document is your Notice of Award. You all would have received this through ERA Commons. The NOA is the authorizing award document from SAMHSA. Please read your NOA carefully and in its entirety. And I will say that the first Notice of Award that you receive is the closest thing that SAMHSA gives you to a complete list of items that will be due over the course of the grant. So it's definitely important for you to print out a copy of that first Notice of Award and keep that handy. Now we'll be talking briefly about GIPRA data collection requirements. So there are 2 GIPRA data collection requirements on the TOR grant. The first is the GIPRA program level instrument. And this applies to grantees who are using TOR funds to purchase and distribute naloxone kits. And you will be, if you are doing this, you'll be required to report the number of naloxone kits purchased and distributed on a quarterly basis. The second GIPRA data collection requirement for TOR is the client level instrument. And this applies to grantees who are providing individual client level treatment or recovery services. You'll be required to collect client level data on several elements, including but not limited to diagnoses, demographics, substance use, services received, types of medication-assisted treatment provided or received, and several other data points. And all of this data will be entered into SAMHSA's Performance, Accountability, and Reporting System, otherwise known as SPARS. And a little more on the client-level data collection. So there will be 3 data collection points for the client-level data. The first is at baseline, when a client enters your program. The second data collection point is at the 6-month follow-up. So 6 months after a client enters your program, we ask you to collect data again. And then at discharge, when a client is discharged from your program. And all grantees will be granted access to SPARS, which is where you will upload your data. The project director listed for each grant in ERA Commons will receive an email with a SPARS user access form to start a SPARS account. If you have questions about that process, please feel free to contact the SPARS Help Desk, and the phone number and email are both there, or contact your government project officer. And here are some next steps for GIPR data collection. So the first step is that TOR grantees should discuss specific data collection requirements per the grant application with your assigned GPO to determine your GIPR targets and your GIPR data collection responsibilities. Once you've done that, you should review the GIPR data collection tools and other associated documents such as the FAQs, the question-by-question guide, and other documents. Once you've done that, you should begin collecting and entering the required GIPR data as soon as you can. And then finally, discuss any questions that you have or concerns with your assigned project officer. So we will be holding a webinar on introducing the GIPR data collection tools and SPARS 2 weeks from today on November 12th. And that webinar will start at the same time, 2 p.m. Eastern Time. You all should have received a link to that. If you didn't, please reach out to your project officer. We'll be happy to share that with you. And that will also help you get started on GIPR data collection. And here is our contact information for our team, Amy, Alini, and myself. And we will make these slides available so you'll have this information. And with that, we will now take any questions on the material that Amy and I have presented so far.
Thank you. We will now begin our question and answer session. If you would like to ask a question over the phone lines, please press *1 from your phone, unmute your line, and speak your name clearly when prompted. Your name is required to introduce your question. To withdraw your question, press *2. Again, to ask a question over the phone lines, please press * then 1. One moment as we wait for any questions.
Thank you. As we wait for questions, I see just a few questions that came through the chat. One is regarding a copy of the presentation. So we will be sending the PowerPoint to everyone after this webinar. So the slides will be sent after this presentation today to all of the participants. And if you have not put your grant ID and your grant name, please do so. If you do not have your grant ID with you at this moment, that's fine. Just let us know. Just put your grant name and your location. That's fine.
We do have one question over the phone lines. Our first question comes from Caitlin McCullen. Your line is open.
Hi, good morning, everybody. Thank you for taking the time to meet with us. This is Caitlin McCullen, and I'm with Cook Inlet Tribal Council in Anchorage, Alaska. We are a TOR recipient. We are very grateful for this opportunity to partner with SAMHSA. I had a few questions, so I'll try and limit them. When should we expect to hear from our project officer about setting up the individual calls to discuss startup?
So those are happening now. We are in process of contacting all the new grantees to set up the calls. We do have 92 new funded programs, so it's taking us a little bit of time. But if you have any questions, please reach out to your GPO, and we will make sure that
it's cutting out.
Oh, sorry.
Hello?
Can you hear me okay?
Now I can.
Okay, sorry about that. So we are in process of scheduling the calls right now. please reach out to your GPO, and that would be me. If you could just send me an email, I will schedule a call right away.
Okay, thank you so much.
You're welcome.
Am I able to ask my other questions? I had 4 in total.
Sure, you could go ahead and ask all 4.
So the next one I have is that you guys are requesting that services be provided in the 4th month, and we are looking to go online the first day of the 4th month. But if we experience any hiccups or anything, is it by the last day of the month that we have to have our first recipient in, or is it by the first day of the 4th month?
Ideally by January 30th. If you have any challenges meeting that date, you could just let me know, and we can I could just discuss the challenges, and that's fine. We just need to know what if there are any specific problems.
Great, thank you. And then recovery housing, you guys noted in this presentation that it has to be in an appropriate and legitimate facility. Does this mean that it has to be a designated sober living facility?
Well, we understand that a lot of tribes don't have certified recovery housing. So we are able to work with each grantee to see, what type of housing is available. We have programs that are covering costs for sober living facilities or other types of recovery housing that may not be certified due to the lack of, recovery housing in many communities. So if we could discuss that during the individual calls, but it is possible to use TOR funding for housing, depending, just to see what is available. Our requirement is that client receiving housing assistance must be part of a treatment program. So they must be receiving services with a treatment program and case management and have regular contact with a case manager.
Okay, thank you. Mm-hmm. And then you said TOR funding, I'm not sure if I heard this correctly, but TOR funding can be used to cover the cost of COVID. What did you mean by this?
Well, telehealth. You can implement telehealth related, you can provide any kind of service via telehealth, as well as any type of supplies that you may need to respond to your clients. And these could include PPE equipment. We could include, any protective gear for the counselors, outreach workers, anyone that has contact with clients.
Okay. Thank you.
Sure.
And that was all of, I did have one more. You guys recommended a tobacco-free campus, which we are, but does this mean that you're also recommending nicotine-free, such as for nicotine replacement therapies?
No, it does not mean that.
Such as if they were on a cessation program.
Right. No, we definitely promote the use of tobacco.
If you're speaking, I cannot hear you.
Did you hear the response?
I think your mic or something is turned off.
Okay. Well, the response to that question was no. So that is, they don't have to be nicotine-free facilities.
Okay, thank you.
Sure.
Amy, can you hear me okay?
I can hear you, yes.
Okay. Yeah. We have quite a few questions coming in on the chat and Q&A. I don't know, operator, did we have other people on the line with questions?
We have no additional questions over the phone lines. Okay. The remaining questions are over the Q&A web box.
So looks like Dale Felicia has asked, will we be able to assist all natives regardless of what tribe they are in? And the answer is yes. We can assist all natives regardless of tribe. That really comes down to your program and who you plan to serve. We don't impose any kinds of restrictions on who you can serve with your grant. And then Frank Kearns has asked, are there specific requirements for the strategic plan? And really the extent of the requirements for the strategic plan is in that first bullet in the funding opportunity announcement, just that it should be based on the most current epidemiological data available, and it should be comprehensive in that it addresses any gaps in prevention, treatment, and recovery support services. And we ask that you complete this within 60 days of the grant award. So that would be by the end of November.
Yeah, but let us know if you need an extension with the strategic plans. And we do have a template available, and we can send that template as well.
Okay. And a question from Marcy Lischemp. If we're providing naloxone with other funding sources, we will not be required to submit detailed reports to TOR, correct? And yes, if you are purchasing naloxone with other funding sources that is not TOR, then you will not be responsible for reporting naloxone kit data into SPARS. You only need to do that if you are purchasing the naloxone kits with your TOR funding. It looks like we had some questions in the Q&A. Are you able to see those, Amy?
Let me take a look.
Can't tell who sent them to all of us or just to me.
Yeah, I don't see any questions in the Q&A.
Okay, so maybe, okay, let's see. So the first question from Stephen Godin, he said, unrelated to this presentation, where do we access the grant reviewers' summaries for helpful feedback? I think I would recommend that you reach out to your project officer and they can see, what they're able to do for you in response to that question.
Oh, actually, I can see Will, so I could take the next question. Okay, we have a question from Eric Vincent. Can a patient with a currently active SUD, not OUD, be supported in recovery housing with TOR funds? A concern is preventing the development of additional active SUDs, including OUDs. Under this FOA, yes, so we can support anyone with an OUD or an SUD. There is another question from Raymond. What constitutes or defines related to recovery services to GIPRA? Oh, so for recovery services, individual sessions, any individual session needs a GIPRA interview. So if you're providing individual treatment sessions or individual recovery sessions, those would need a GIPRA, a client-level GIPRA interview.
Right. So something like peer recovery support services, where you have a peer funded through your grant program who's working with individual clients over an extended period of time, we would ask you to collect GIPRA data for those services. But if it's a group-level recovery service, recovery groups, then we would not ask you to do GIPRA just for that. But we recommend that you speak to your GPO about this further, and you can talk about your specific program to see, how GIPRA applies in your case. And operator, were there any other questions on the line at this point?
Yes, we have one last question over the phone lines. Our last question over the phone lines comes from Teresa Curo. Your line is open.
Hi, thank you, everybody. My question is concerning the GIPRA instrument. I've had some experience utilizing this instrument for another grant, and what I'm coming across, or the issues that I'm coming across, have to do with the follow-up interviews and the discharge interviews. because I think there's like a certain level of percentage that you have to have for like follow-up, and the majority of the clients that we have already served under another grant, we aren't able to follow up with because once they complete treatment, they might drop off the radar, and we have no good contact phone number. We have no way to get a hold of them until they, resurface down the road. So how do we handle that in GIPRA?
Yeah, so programs stay in touch with clients in different ways. We have many TOR grantees that are kind of sending little birthday cards or just getting in touch with programs, with the clients, getting in touch with the clients just by inviting them over for different activities. I know during COVID, a lot of this is difficult to do, mainly because there is not as much face-to-face contact with each client just by, having people come over for just to be able to provide them with some resources. But our recommendation is to do your best to get the most updated information, or to get maybe contact information for another relative or a friend that could let you know where that client is. So it really is a difficult process, so we understand. So if you have a lot of a lot of issues contacting your clients and not having contact for the 6-month follow-up, just talk to your GPO, and we could work with you and give you some ideas on things that you could do. But also, you could start a follow-up early. You could start, during the 5th month. And a lot of programs kind of provide resources for a long period of time to have those clients coming back to the program, and you can provide an incentive for the 6-month follow-up. And we will be discussing this in more detail during the November 12th webinar.
Okay, thank you.
And we had another question in the chat from Colby Coughlin. I have budget questions, should I wait? And yes, if you can hold on for a few moments with your budget questions, the next presenter will be your Grants Management Specialist, Olivia Klein-Thomas, who's going to go over some of the budget topics on the TOR grant. And did we have any other questions on the line, operator?
We have no additional questions over the phone lines.
Okay. And there will be more time for questions at the end as well. So with that, I'm now going to pass the ball here over to Olivia Klein-Thomas, who is the Grants Management Specialist on the TOR grant.
Thank you, William. Hi, my name is Olivia Klein-Thomas, and I work with SAMHSA's Division of Grants Management, Office of Financial Resources. In this portion of the webinar, we will be covering SAMHSA contacts, notice of award, recipient roles and responsibilities, payment management system, financial reporting requirements, post-award amendments, and ERA comments. Your government project officer and your grants management specialist are the 2 individuals you should contact should you have any issues or items that need to be discussed regarding your grant. For assistance with programmatic issues, as Amy mentioned earlier, related to your TOR award, please contact your GPO. And for assistance with financial issues, feel free to reach out to your grants management specialist. To locate your assigned GPO or GMS, you have 2 options. You could either refer to the last page of your notice of award, or if you don't have that handy, you can go to ERA comments. All you have to do is go to the status menu in ERA Commons, and you will find a real-time, up-to-date assignment of your GMS and your GPO. I just want to let you know that as of last week, I have taken over the grant portfolio of Karen Warner. So if your notice of award lists her as your GMS, I have now been assigned her grant. So I will be reissuing revised notice of award to reflect this change in the upcoming weeks. So if you have any questions as it relates to your budget or any post-award amendments and you have her listed as your contact, please don't reach out to her. Please reach out to me. If you have already, that's fine. She's been forwarding me emails and phone calls, but I am the new Grants Management Specialist for Cohort 2020. The Notice of Award is the legal document issued to notify the grant recipient that an award has been made and that funds may be requested from the designated HHS payment system. The Notice of Award is issued for the initial budget period and for most post-award amendments. The Notice of Award is a document that is sent electronically via email to the business official listed on the award. Okay, the following link will take you to a sample to view as a reference. Your Notice of Award highlights several important details and useful information. I won't read the entire list for brevity. However, you should pay special attention to Section 2's payment hotline information. Here you'll find information about accessing your award funds in PMS. The terms and condition component in Section 3 is very important. This basically explains the general laws and regulations that govern the award, and the special terms and conditions in Section 4, which includes special program-specific and grant management terms and conditions that must be addressed during the award. It also includes important dates and deadlines and stuff like that that you should be aware of. Okay, recipient roles and responsibilities. The Authorized Organization Rep, or AOR, is the person authorized to sign the grant application as the official representative of the organization and to act on behalf of the applicant and assume the obligations imposed by federal laws, regulations, requirements, and conditions that apply to the grant applications or awards, including fiduciary authority and responsibility. The project director is the individual who provides daily oversight of the grant, including fiscal and personnel management, community relations, implementation, and evaluation. Now, based on this year's FOA, 100% level of effort is required for the PD position. We've gotten a lot of questions about this, whether or not this is flexible or if the duties and level of effort can be shared amongst multiple PDs. And we've decided that we will review this on a case-by-case basis for those who are having trouble meeting this requirement, okay? So just respond to the term and condition if you receive that in your notice of award, and outline for us how you can distribute the level of effort amongst the key staff. And if it means you need to update your budget as well, you can include a revised budget, okay? I won't go into further details about that in this presentation, but you can reach out to me directly if you have any questions. All right, moving right along, the business official is the individual identified in the application as being the primary party responsible for overseeing the financial aspects of the grant. And once again, this is the person who will be turning in reports and who will be receiving the notice of award letter. Okay, payment management system. All right. Grants payments are managed through the Program Support Center Payment Management Services, which is a separate federal entity from SAMHSA, okay? The payment management system is a centralized grants payment and cash management system operated and developed by PSC as a secure online grants payment platform, which provides awarding agency and grant recipient customers with efficient grant and grant-like payments, cash management, and personal grant accounting support services. Recipients that are not on restricted status may make electronic fund transfers, request payments as often as needed. However, drawn down funds must be done within 3 business days. And here we have some useful PMS resources. They include a user guide to help you navigate the PMS system, access to a library of taped trainings, PMS roles and responsibilities, etc. And lastly, everyone is assigned their own PMS liaison accountant. So this link here will take you to the one that is assigned to you. Okay, the Federal Financial Report, also known as the SF-425, is due to SAMHSA within 90 days after the end of each budget period and is submitted through the ERA system. Okay, this means for you Year 1 grantees, yours would be due December 30th, 2021. Instructions on how to submit Federal Financial Report via ERA Commons. The links are here, and additional guidance can also be located on this slide. Okay, the Federal Cash Transaction Report, FCTR, is utilized by the Division of Payment Management, which administers the payment management system. Recipients use the FCTR to report award-specific cumulative cash outlays of payments. FCTR reports are due to PMS, not SAMHSA. Okay, so you won't be submitting this report through ERA. This is directly through the payment management system, and it's due within 30 days after each calendar quarter. Okay, so the schedule is on your screen. Be sure to submit your FCTR on time. Okay, if PMS does not receive it on time, they will put a hold on your account, and we don't want that. Additional information on the FCTR is available at the DPM homepage. Okay, recipients must also conduct and submit a single or program-specific audit conducted for that year if you expend $750,000 or more in total federal funds during the recipient's fiscal year. Okay, the audit must be submitted to the Federal Audit Clearinghouse (FAC) either within 30 days after receipt or 9 months after the end of the fiscal year, whichever is earlier. Okay, post-award amendments. As a federal grant recipient, you may need to modify your grant award or other aspects of your approved application during the year to accomplish certain program goals. This is what we call a post-award amendment. Post-award actions or amendments requiring prior approval are exclusively processed through the ERA system. Okay, so you must have an ERA Commons account to submit a request, and this hyperlink here will take you there to so that you can register if you haven't registered already. Some post-award amendments require explicit prior approval from SAMHSA Grants Management Office before being implemented. If you don't obtain the proper prior approval, it may result in the disallowance of some costs, termination of the award, or other enforcement actions. Submission of an amendment application in ERA prompts the GPO and GMS to review the request and complete the corresponding checklist. During the review of a post-award action, the GPO and GMS may send you a RAM, okay, that stands for Request for Additional Materials, communication asking for additional information about the request. Once the checklists are completed, the GMS will approve the request and prepare an amended notice of award. Verbal authorization or emails or anything like that are not approvable and are not binding by SAMHSA. Recipients that proceed on the basis of actions of unauthorized approvals do so at their own risk, and SAMHSA is not bound by such responses. Some common post-award activities that require prior approval include change in key personnel, budget revisions exceeding 25% of the total grant award, or $250,000, whichever is less, change in scope, carryover, and no-cost extensions. Please visit SAMHSA's post-award amendment page below for a full list of amendment types. We also have some helpful step-by-step resources on how to submit a request and what to submit in a request. Here's a link to register for ERA Commons again if you're not registered. Questions on how to access or navigate ERA Commons should be directed to the ERA Service Desk. You can contact them during these business hours and the numbers on your screen. Okay, here's some other useful grant resources that you can review at your own leisure. They include the PMS link, grants policy statement, system for award management, and of course the ERA link. Okay, this concludes my portion of the presentation. I will now open the floor up for questions. Thank you.
As a reminder, to ask a question over the phone lines, please press star, then 1, unmute your line, and speak your name clearly when prompted. To withdraw your question, press star 2. One moment as we wait for any questions. Our first question over the phone lines comes from Colby Coughlin. Your line is open.
Hi, I wanted to ask some questions about allowable costs for this grant. My first question is if there is a cap on how much housing assistance we can provide for folks in recovery. So whether it be for rent or utility bills, if there is, for each person in recovery, you can only spend $100 for the year. Is there any cap like that?
Amy and William, do you know if there's a cap on housing?
No, there is no cap in housing, but it should be consistent with your grant application. So if you said in your grant application that in your original budget, you have, let's say, $100,000, that's what has been approved. But if you're trying to change that, we just have to have a discussion. Have a discussion with your GPO. If it's over 25% of your budget, we need formal approval from the Office of Grants Management. But there is no specific cap, but it should be consistent with your grant application.
Perfect. Thank you. Another question I have is because we're during COVID and a lot of the patients are not being seen 100% in person for recovery services, some of it's virtual and some of it's in person, if they're allowed to in that county or in that tribe based on the rules during COVID. And so some of our tribes are sending out wellness kits, and it's something that, we've talked about with our GPOs. It's been in the narratives of the grant. But the question is what can be included in those wellness kits? So is that something that I can ask directly on this call, or should that – I've sent an email twice and not received a response, so I didn't know if I should do it on this call or if I should send a third request.
I would contact your grants management specialist. Again, we're in transition of assignments, so if you didn't get a response, that may be a reason. But, yes, please contact me. Let me use this opportunity to provide my contact information because I forgot to put it in the presentation. My phone number is 240-276-1413, and the email is olivia.kleinthomas@samhsa.hhs.gov. I'll add that to the chat link so you all can have that copy.
Okay, thank you. I'll send a third request for that then.
No problem. Thank you.
Our next question over the phone lines comes from Caitlin McClellan. Your line is open.
Good morning. One of my questions was already answered regarding recovery housing, and then my last is just a clarification, and I think it's pretty straightforward, but I just want to make sure my train of thought is correct. If we change who the project director is, that would have to be, before it's acknowledged or approved, the request would have to be processed in the ERA system?
Yes, it will have to. You'll have to submit it in the ERA system, and your GPO and GMS will review.
Thank you.
You're welcome.
We have no additional questions over the phone lines.
Okay. I don't see any other questions in the chat. Oh, let's see. We do have one from Mary Daisy in the Q&A. She says, "Hi, Olivia. In our NOA terms and conditions, we are revising our budget, and I wonder if we still do only the first year on the SF424A."
Yes, do the current budget that you are updating only.
All right. Well, if we have no other questions for Olivia, then we will be moving on to the next portion of our presentation today. Thank you, Olivia.
Thank you.
I'm going to turn it over to Umberto Carvalho, who's going to talk to you all about SAMHSA training and TA resources.
Thank you, Will. Good afternoon, everybody. My name is Umberto Carvalho, and I'm a project officer in charge of several programs, training and technical assistance programs that SAMHSA has available for not only grantees, but for any healthcare provider in any of the 50 states and territory of the U.S. So I'm just going to start by showing you what we have available. If you go to the SAMHSA website, on the first page of our website, you're going to see on the second tab is called the Practitioner Training tab. That tab is going to show you several programs that SAMHSA has in place that provide resources for anybody. You can access these resources by entering each of the websites that these programs have. Some of those programs are different in nature. Some of them have specific focus areas. But if you navigate through this page, you're going to be able to find several interesting programs that provide resources that may be of your interest or the interest of your program. So I would encourage you to go to the SAMHSA Practitioner Training web page and take a look at what's available there. And the website to that specific page is listed on this slide as well. So one other thing that SAMHSA has in all our training and technical assistance programs have in common is that we all use evidence-based practice as the base of the training program that we implement. And for that, SAMHSA has what we call the Evidence-Based Practice Resource Center. This resource center is pretty much a repository of EBPs for prevention, treatment, and recovery. There's a committee that reviews and ensures the effectiveness of all these practices there, all these EBPs that are included in this resource center. You're going to find several practical implementation tools under this resource center, and this center is actually updated routinely. So if you're looking for something today and you don't find it there, it doesn't mean that in a couple weeks or in a couple months, it may actually be there. So I'll again encourage you to visit this resource center if you're looking for specific evidence-based practice that you are interested in working with. So I'm going to start talking about one of our main technical assistance and training programs, which is the Technology Transfer Center program. The purpose of this program is to develop and strengthen the specialized behavioral health care and primary health care workforce that provides prevention, treatment, and recovery support services for substance use disorder and mental illness. The mission of this program is pretty much to help organizations incorporate effective practice into substance use disorder and mental health prevention, treatment, and recovery services. This program is comprised of 3 networks. And we represent these 3 networks in this triangle format because in one way or the other, they complement each one complements the other. So we have the ATTC, which is the Addiction Technology Transfer Centers. We have the PTTC, which is the Prevention Technology Transfer Centers. And we have the MHTTC, which is the Mental Health Technology Transfer Centers. These 3 networks, they are implemented in the country in a regional format. But each of the networks, they have one coordinating office, one center that is dedicated to American Indian and Alaska Native communities, one center dedicated to Hispanic and Latino communities, and 10 regional centers. If you look at each of these regions highlighted in this map of the U.S. and this slide, we have a triangle inside of each region, which means that we have one regional ATTC, one MHTTC, and one PTTC in each of these regions. And we also have, obviously, 3 network coordinating offices, 3 American Indian centers, and 3 Hispanic and Latino centers. So those centers are all housed within, the majority of them are housed within universities. And this slide here shows you which organization your regional ATTC is located. So, but I'm going to provide you more information and more an easier way for you to find the center that serves your region and your state, so you'll be able to connect with your center. So one thing that all these 3 centers have in common is they have the exact same website structure. The backbone of the website is the same, which makes it very easy for you to find information and resources. So all the websites, they have a first tab where you can find your center. In the case here, I use the ATTC as an example. You're going to, there's a tab that you can find your center. There's an education tab where you're going to find a lot of the training resources and events that are happening. Inside of this tab, we have a training platform that we call Health in-Knowledge. That's where you're going to find a lot of self-paced online trainings that you can take. Most of the trainings inside of those, all trainings inside of this platform provide a certificate of completion, and a lot of them, if not all of them, provide CEUs. So make sure that you visit that as well. There's a resource tab, there's a project tab, and a communication tab also, and I'm going to give you a better example of how this website operates. But, so how is it that these 3 networks provide training? So these are the modalities. So they provide training by providing information dissemination in the regions where they serve. They do that by electronic publications, by email distribution, and by a lot of social media. They do a lot of learning events. A lot of them can be in person. Right now, because of COVID-19, the in-person events have been canceled, but we hope to resume that as soon as the situation is under control. They actually have a lot of presence in many conferences around the country, sometimes national conference, sometimes regional. They do a lot of training of trainers, and they provide a lot of webinars. They do virtual learning communities, and for that, the way that you participate in this community is by reaching out to your regional center and finding out what kind of learning communities they have going on, and you can subscribe to be part of one of them. They provide, like I said before, online course. A lot of the courses are instructor-led, and most of them are self-paced. They also do something we call the intensive technical assistance, which is pretty much a combination of different types of techniques of learning and connectivity. Sometimes they use echo training, sometimes they use peer learning networks, and that all combined creates an intensive technical assistance module. They do a lot of product development. They develop a lot of assessment tools, curriculums, mobile apps, multimedia resources, slide sets. That's all available inside of their website, and I'm going to show you where you can find all those things. Anything inside of this website is free to access. You do not pay for any of the materials or any of the trainings that you take under this network. They also provide consultation and technical assistance. Most of the time, those consultations are virtual. In very few occasions, they are in person. So this here is a shot of the screenshot of the ATTC, of the Addiction Technology Transfer Center, just to give you a quick overview of where you find information. So on the first tab where you see your ATTC, because I am in Maryland, So, you see on the side, on the right, on the left side, your center, you see Central East ATTC. This website has a geolocator that automatically points you out to your ATTC center. So my center is the Central East because I'm aiming in Maryland. So, but you also can see all the other centers, all the other 9 centers in the country for all the regions, and you can enter any website if you want to explore what they have. Maybe sometimes they have something different. And you also have on the side there, which I highlighted with the red circle, for instance, the National American Indian Alaska Native ATTC. This is a national focus center area focused on tribal communities, so that center has lots of interesting resources that will be of your interest. On the educational tab, again, that's where you have the Health in Knowledge self-paced online platform. So you see here in the bar that says get connected, get informed, get trained. So if you go inside of each of those portions of the website, you will have opportunity to subscribe to receive updates, to be part of their listserv, so you can be informed and receive information of anything that's happening in your region that may be of your interest, that sometimes you can even participate in person. I encourage all of you to go to this website to subscribe to that listserv, and specifically go to your regional website for all 3 networks, the ATTC, MHTTC, and PTTC, and subscribe to receive information of their activities. So if you go to the resource tab, when you click on the resource tab, you see here product and resource catalog. This site, has a searching feature. For instance, in the case here, if you're looking for a resource related to hepatitis. So, and then when you click there, you're going to be point out to all resources under that subject. So if you're looking for MAT, you can put MAT there, and then all resources that the network has related to MAT will show up there. It can be webinars, it can be training materials, it can be informational modules, several types of resources. And also evidence-based practice resources. If you click on that tab there, you can access several interesting resources on that subject. So here's some examples of the resources. So on the main tab of the ATTC network, you have, on the main carousel, you have several parts of the network that are dedicated to specific subjects. For instance, the first one, taking action to address opioid misuse. If you enter on that push on that tab of the network, or of the website, you're going to see all resources related to opioid misuse, opioid treatment, MAT, and you're going to actually have specific resources for peers, for counselors, for psychologists. So there's a wealth of information and links to interesting resources that you may take advantage of. Same thing, the second one, focus on stimulant misuse. That tab will connect you with specific resources. Same thing, the building telehealth capacity, that portion of the website will connect you with many resources on how you can implement telehealth. And there's lots of trainings, lots of webinars. And if you still have questions, you can connect with your regional center, and they will try to help you on a one-on-one basis. So there's also a tab for COVID-19 with lots of resources related to how to continue providing treatment during this environment of COVID-19. And like I said, there's the Health in Knowledge, where you're going to find lots of interesting training, self-paced training. This that I'm showing right now is the website of each of the American Indian and Alaska Native ATTC, MHTTC, and PTTC. As you can see, they're kind of similar. What changes the color and some of the materials there, but all of them have the exact same structure. You can see the upcoming events, you can see the product, and again, I would recommend for you to not only subscribe with your regional center, but also with the National American Indian and Alaska Native ATTC, MHTTC, and PTTC. And again, they all have many events and many information opportunities available for you, and many materials that you can benefit, that can be very beneficial for your program. Here's just some examples of what you can find on the American Indian Alaska Native TTC. You have the alcohol and drug exam preparation resources. If anybody from your center is interested in taking that exam, you can get all the resources here for training. There's a specific tab for TOR Training Technical Assistance webinars. There's another tab. There's the Tribal Opioid Response Program. So these are all information and materials. Like I think earlier on, Amy or Will mentioned to you about making your activity plans or your strategic plan. Sorry, thank you. Yes. So that's where you're going to go. You're going to find examples of how to put together a strategic plan. So there's also a resource for transforming tribal communities, building culture strengths, and there's like such helpful literature. These are all tabs from the website that you can go and explore. Now, when you enter the American Indian and Alaska Native ATTC, for instance, you're going to see on the website of the center, you're going to see this gray tab. And when you go to that gray tab, you're going to see Tribal Opioid Response. Again, that's where you go to find all specific resources for the TOR program. You have a TOR resource page, and you have a TOR technical assistance webinars. All webinars that have been already recorded, that have been provided for all the previous TOR grantees, is stored there, and anybody can listen to those webinars at any time. There's webinars related to several different subjects that may be of your interest. So if you're having specific information on how to access those resources, or how to, if you have any question or if you want some assistance, you can connect with the team from the American Indian Alaska Native ATTC, and the email here. His name is Jeff Ledolter. He's from the IU University. You can send him an email, and you can ask him any question that you may be interested in regards to the resources that are available there. So aside of those of the addiction technology transfer centers and the TTCs in general, SAMHSA also has some other training and technical assistance programs that may be of your interest. For instance, we have a Center of Excellence for Protect Health Information. This Center of Excellence, their mission is to develop and disseminate resources, training, and technical assistance for state healthcare providers, school administrators, individuals, and families to improve their understanding and application of federal privacy laws and regulations, including FERPA, HIPAA, 42 CFR Part 2, when providing and receiving treatment for substance use disorders and mental illness. Recently, you all know that 42 CFR Part 2 has several modifications, and this center has created webinars to explain what are the changes, the 2020 changes on 42 CFR Part 2, especially during the time of COVID when some flexibilities were implemented. So if you have any question or if you need to know anything in detail, you can connect with this center. And in this center, you can actually request one-on-one consultation. So you can send them an email. You can go to their website, connect with, send a TA request, and they will contact you. And any question or anything you need, they will work with you on a one-on-one basis. Another program that we have in place is the Provider's Clinical Support System for Medication Assisted Treatment. We call the PCSS MAP. This is the website over here. The purpose of this program is to expand the number of Drug Addiction Treatment Act dated to 2000 WAVE providers, increase understanding of the importance of medication assisted treatment, and ultimately increase access to MAT through the expanded prescribing of FDA-approved medications for the treatment of opioid disorders. This training, if you look at this picture there, there's an education and training tab of this website. If you look at this website, you're going to find over 800 different trainings that are available there that you can take the trainings, and everything is free of charge. So you can connect with them as well and receive and look through all the trainings that they have. And you can also connect with their help desk if you have any question or information on how to reach, or you can also contact your GPO or myself, and we'll connect you with the specific resource you're looking for. So there is another program that I did not include here, but I'm going to actually send it to all your GPOs to send it to you, which is the Opioid Response Network. The Opioid Response Network, it has local consultants in all 50 states and 9 territories to respond to local needs by providing free educational resources and training to states, communities, and individuals in the prevention, treatment, and recovery of opioid use disorders and also stimulant use. This is a program that you can, when you reach their website, you can actually submit a request for TA, and they will, again, someone from that program will contact you individually and will provide you one-on-one consultation on whatever you need related to opioid or a stimulant. So anything related to the program that you want to implement. So this is actually a very good resource, and again, I'm going to provide this information for your GPO so that they can send it to you after they send you this information. So this is like a very brief overview of some of the programs that we have available. I'm open for any questions if anybody has any questions at this point.
As a reminder, to ask a question over the phone lines, please press star then 1, unmute your line, and speak your name clearly when prompted. One moment as we wait for any questions.
Okay, while we wait for questions, we have a resource that Erin Vincent would like to share with everyone, and this is the Indian Country Echo. So I will put it on the chat for everybody to see the website for the Indian Country Echo that provides an SUD echo as well as peer support and harm reduction echoes. Thank you for that resource.
And at this point, if you have any questions for Umberto or Olivia or for Amy or myself, please feel free to ask them now. And for anyone who may have arrived late or missed the webinar today, we did record the webinar and we'll be disseminating the recording along with a copy of the PowerPoint slides after the webinar today, so you'll all have those materials to reference.
Okay. Yeah, I don't see any questions. But if you have any questions during the startup of your program, please feel free to contact your GPO, and we will be providing you with a lot of resources. I know this is a lot of information provided to you in an hour and a half.
This is the operator. We do have one question over the phone lines.
Okay.
Our question comes from Eric Vincent. Your line is open.
Hey, Amy. I was just going to add a little bit to that as far as the ECHO. So we're a tribal organization here in Portland, Oregon, overseen by the 43 federal recognized tribes, and we have the SAMHSA as well as OMH grant that supports substance use disorder ECHO that is a great opportunity for any tribes out there who have providers who are starting or already treating with MAT for their patients to get a terrific opportunity for case presentations with de-identified information that can then be provided recommendations for their care. Our faculty come from the Addictions Fellowship Program at Oregon Health and Science University. There's a Native social work individual on faculty as well as a Native peer support specialist. So we have a very holistic approach to that. So anyway, just want people to know about that resource. And you had mentioned the Peer ECHO as well. That's a collaborative effort with the Southern Plains Tribal Health Board. And then there's a harm reduction ECHO if anyone's looking at their harm reduction efforts, syringe service programs and other sorts of things. And that's a collaborative effort with the State of Oregon Health Authority Viral Hepatitis Program. Thanks.
Thank you. Okay, well, at this time, I don't see any other questions, so we will conclude our webinar for today. So thank you so much for joining us. We will be sending a copy of the PowerPoint presentation to everyone, as well as the TOR page with all of the previous webinars and resources for TOR programs. So just let us know if you could please, if you have not done so, please put the name of your program and your grant number if you have that with you. If not, just the name of your grant will be fine before you disconnect. Well, thank you, everyone. Have a great afternoon.
Thank you for your participation in today's conference.
Thank
you may
you.
disconnect at this time. Speakers, please stand by.